Now we will pick up with the electrolyte calcium. Calcium's normal level should be 8.4 to 10.5. We get calcium by intake and absorption from dairy products, broccoli and oranges. Calcium requires vitamin D for the best absorption. Now, calcium is low in extracellular fluid. It's mostly in the bones and the intracellular fluid. Ionized calcium is the active calcium. So only ionized calcium is active calcium. Calcium is controlled by the parathyroid hormone, or PTH, and calcitonin. Calcium is also influenced by vitamin D and phosphate. So, if calcium is influenced by vitamin D and phosphate, and calcium is controlled by the PTH and calcitonin, if low blood calcium levels, if blood levels of calcium were low, what would that stimulate the secretion of? Parathyroid hormone, which would increase calcium absorption from the digestive tract and would promote resorption from the bone. Now, vitamin D can be ingested or synthesized. Vitamin D is synthesized through UV rays. Vitamin D must be activated by the kidneys. Vitamin D promotes calcium movement into the blood. Now, if calcium is high, phosphate will be low. If phosphate is high, calcium will be low. They have a reciprocal relationship. An increase in calcium is termed hypercalcemia. Some causes might be bone tumors that destroy the bone, causing an uncontrolled release of calcium. Parathyroid hormone, or PTH, may be excreted in excess due to a tumor. Hyperparathyroidism. Immobility, which causes decreased stress on the bone, or demineralization. An increased intake of calcium because of excessive calcium intake or intake of vitamin D. And hypercalcemia can also be caused by an increase in milk and antacid intake. Now, symptoms would be constipation, diminished reflexes, personality changes, and lethargy. Now, high calcium levels can cause a heart block. If excess parathyroid hormone is the cause of hypercalcemia, bone density would decrease and fractures may occur, particularly in the weight-bearing areas. Now, if intake of calcium is high, parathyroid hormone levels will be low, and more calcium will be stored in the bone, maintaining bone strength. Decreased levels of calcium is referred to as hypocalcemia. This can result from end-stage renal disease, a calcium-deficient diet, or hypoparathyroidism. Now, some symptoms that we'll see with hypocalcemia, we'll see Chavosk's sign, and that's spelled Chovsteks. That's when you tap on the face and there's a contraction of the facial muscle. Now, we can also see hyperactive reflexes, laryngospasm, and dysrhythmias with hypocalcemia. Our next electrolyte is magnesium. Magnesium's normal level is 1.5 to 2.5. Magnesium is ingested from dark leafy vegetables and whole grains. Magnesium is normally low in the extracellular fluid. It is mostly in the bones and intracellular. Only free magnesium is active. It is rare for an imbalance of magnesium, but an increased magnesium level is considered hypermagnesemia. Now, end-stage renal disease can be a cause of this, or excessive use of magnesium-containing laxatives. Symptoms would be hypoactive deep tendon reflexes, bradycardia, and hypotension. When we have low magnesium, that can result from alcoholism, vomiting, diarrhea, or malnutrition. We can see Chavosk's sign in this, as well as muscle cramps, tachycardia, and hypertension, and dysrhythmias. Our next electrolyte is phosphate. Phosphate's normal level is 2.7 to 4.5. Phosphate removes hydrogen ions from the body through the kidneys. Phosphate has that reciprocal relationship with calcium. Now, hypophosphatemia may result from diarrhea, malabsorption, and excessive use of antacids, alkalosis, or hyperparathyroid hormone. Now, effects of hypophosphatemia usually display in with the neurological dysfunction, tremors, weak reflexes, paresthesias, confusion, oxygen transport decreases, and clotting decreases. Now, with hyperphosphatemia, this can result from renal failure. Tissue damage can cause a release of the phosphate. Manifestations are the same as hypophosphatemia. Now, for your acid-base balance, your normal levels, I want you to remember that your carbon dioxide is 35 to 45. Your bicarbonate is 22 to 26. And your normal pH level is 7.35 to 7.45. When you think of carbon dioxide, I want you to relate that to the respiratory system and the lungs. And whenever you think of bicarb, relate that to the metabolic or the renal system. I do want you to remember not only how to decipher the ABGs, but what can be the cause of some of the acidosis and the alkalosis. With respiratory acidosis, remember that pneumonia and airway obstructions, chest injuries, the use of opioids, and COPD or head injuries can cause respiratory acidosis. With metabolic acidosis, I want you to remember that diarrhea can be a cause of metabolic acidosis. Renal failure can be a cause of metabolic acidosis. I also want you to know with respiratory alkalosis that hyperventilation can be brought on by anxiety, high fever, or an overdose of aspirin. Head injuries and brainstem tumors, and asthma here as well with the both respiratory disorders. Now, metabolic alkalosis, I want you to remember with this, it can be from vomiting, hypokalemia, and an excessive ingestion of antacids. I'll stop here, and then I will begin a new recording.